With the explosion of technology in healthcare, we've got lots of different ways that we can monitor people and try to have an early intervention when a fall happens. But having a technology that can actually use artificial intelligence to analyze behavior and then use that information to predict a fall is huge.
Once I got into geriatrics, falls were almost a everyday or weekly occurrence in terms of patient care. We're now at around 52 million Americans over 65, and they're predicting by 2050 that's going to be 82 million Americans. And of that, about 1 in 3 or 4 people of that age fall. And the falls are the leading cause of disability and, if you will, serious injury in this age population. And it leads to hospitalization, it leads to nursing home placement, it leads to death. It's a cost to the U.S. The total was around $50 billion, which is a lot of money. I think one of the problems that healthcare providers have is that people who are suspected of fall, first of all, people who have fallen once double their chances of falling again. And many of them are bedridden, and yet they attempt to get out of bed. So it requires almost constant surveillance, which we don't have the staff for. At the same time, not just follow them, but be able to develop some kind of individual program that would help prevent the problem of fall of that individual. Since I got into geriatrics, the holy grail has been, let's figure out a way to prevent falls. How do we do that?
We can use our artificial intelligence technology to know that a fall is at high risk for happening, and then somebody can be called to the person's side to prevent the fall from actually happening.
And I think the artificial intelligence gives you flexibility. The EVA program really does some great things. It allows you to be in settings, restrooms for example, other than just patient rooms. Doesn't require constant monitoring. And most importantly, I think it gives you a chance to put in factors in advance that you want to check on, and the data can be analyzed. At the same time, you don't have the problem of confidentiality. The video is done away with at the end of that. So I think it's a very, very impressive product.
I think Vuetech has really got a special product here. You know, nobody really wants to see the intimate details on a video feed of how somebody's living their life. It really helps preserve privacy and dignity for people who are in vulnerable or dependent care settings.
I think it's a product that may be developed for reasons other than just fall, in terms of looking at other situations in medicine. But most importantly, I think it has great potential to be much closer to the Holy Grail in terms of solving the problem of fall prevention.